Yeah, now
Can you hear me?
you have to just
Yeah,
yes.
so, okay, thank you. So I think during this webinar, we've all heard how sodium hyaluronate helps epithelial healing, and I think we all agree that we use it for different types of dry eye cases that we come in our clinical practice because of its properties of healing and water retention and tear film stability. I was wondering whether we could think of and maybe discuss situations of ocular surface disorders where sodium hyaluronate will be beneficial than the other tear substitutes. I must confess that I may not be using it for all these conditions because sometimes it's not in the back of the mind, and that's why I thought I will share some of these situations so that probably we should, uh, think over them and decide whether it would be useful to use these drops in these particular situations. So I thought I'll just look at some of the clinical situations where we can use sodium hyaluronate other than the ones we discussed today, and also see if there is any literature on those specific indications. So I know that most of us treat abrasions by patching the eye, and that means we may not be able to put drops, but sometimes we don't patch the eye if it's traumatic or we feel there is a possibility of some infection, so we would like to treat with antibiotic drops as well. And sometimes when we remove the patch after 24 hours, the epithelium has healed, but probably it is not as healthy as a normal epithelium. So I was wondering whether in these situations, we normally always use an artificial tears as a addition to the antibiotic drops or the ointment that we use, and maybe sodium hyaluronate may be a good option in these patients as it might improve the healing and provide better comfort. And there are some studies which have been done and reported where they had used it for corneal abrasions. And in fact, in one study that I went through, they had mentioned that before they patch the eye, they would put a drop of sodium hyaluronate, and they said that it might be helpful in the epithelial healing once the eye was patched. So I thought maybe this is one again situation that we commonly see in our clinics. We use tears, but probably maybe hyaluronate may be a better option in some of these patients. Of course, we discussed that a lot of post-surgical cases like cataract and post-refractive surgery, we would like to use sodium hyaluronate, and there is a lot of data that we saw today. But then I was just wondering, we have several cases where we end up in epithelial defects on the table, and we always like the epithelium to close up quickly because that puts the fear of infection away from our minds. For example, a cross-linking procedure with epithelium off, or when we do a photorefractive keratectomy or a PTK. Pterygium surgery, especially a large pterygium, creates a significant amount of bare area on the corneal surface. And similarly, when we do other ocular surgeries, such as limbal grafts or excisions, or so number of ocular surface surgeries do leave a large bare area on the corneal surface which needs to epithelize. And again, all these patients are treated with artificial tears, whether it's in the back of the mind or not, whether we would like to use sodium hyaluronate or we use just what comes on our thought or on the pen. There have been some data to show that it tends to accelerate the epithelial healing following a PRK. And there is also a study I could find where they've used it after pterygium surgery, and they found that it enhances the epithelial healing process. We know that diabetics have a cornea problem on the ocular surface. Tight junctions are not up to the mark. So there is poor epithelial cell adhesion, a poor barrier function, an increased permeability of the corneal epithelium. Similarly, the hemidesmosomes are probably not functioning as great, and we know that the diabetic epithelium does not adhere well to the Bowman's. The basement membrane itself may be abnormal and thickened because of an increase in the presence of glycation end products. All these factors may predispose the corneal epithelium or the cells to slough off and probably not adhere well to the surface. In addition, we have trophic related problems because we know that there is a decrease in the subbasal nerve density, which itself also contributes to reduced aqueous tear production in diabetics. We know that for various reasons, there may be an increase in the meibomian gland dysfunction in patients who have diabetes, and there may be an increase in inflammatory markers on the ocular surface in patients with diabetes. So, a number of mechanisms might contribute to not only a dry eye process but also corneal problems that we see. Typically, we also see, for example, when vitrectomies used to be done, the cornea used to be, epithelium used to be debrided. And I remember in my postgraduate training, we used to have problems post vitrectomy when the epithelium would not heal, and it used to be a big problem. So, in diabetics, again, where there are all these type of problems, we need a drug which can aid epithelial healing. And there have been several articles in literature which have looked at sodium hyaluronate and the corneal epithelial healing in diabetics in animal as well as in human trials or human patients. These studies have been done which show that they help the corneal epithelial healing in diabetic eye disease. Similarly, we encounter large epithelial defects with probably injury to the basement membrane structures, and severe cases of chemical burns may have extensive damage in addition. Some of the milder cases may just have an epithelial slough off, and we always use lubricants when we give to a patient in addition to all the other treatment that we give for a chemical burn. And we are basically concerned with ocular surface epithelialization, so that helps to protect from further corneal melting and more complications. And I was wondering whether, in addition to all that we use, maybe sodium hyaluronate given 4 to 6 times a day might be a useful addition to the treatment armamentarium. And as I think Bhaskar also mentioned, there have been several studies on corneal burns in animal eyes where they've used sodium hyaluronate, and they found that it helps the healing process, and the epithelial healing has been studied in animal eyes. And also in human trials, there have been some cases where they found that in alkali burns, maybe the corneal epithelialization in with sodium hyaluronate is faster. Similarly, in cornea practice, we also come across several patients who have recurrent corneal erosions where the epithelium tends to break down repeatedly. We have patients where the epithelium fails to heal. Sometimes we have neurotrophic problems, and patients who have limbal stress or limbal problems due to various reasons may have an epithelial breakdown, or the epithelium may not heal, and they may have punctate staining. Again, in some of these patients, maybe we're trying sodium hyaluronate, as we know that in addition to epithelial migration, I found this study which said that it helps the recovery of the hemidesmosomes, which might be an additional advantage in patients where there is a problem at the hemidesmosome level, in addition to the epithelial healing problem. When we do a corneal transplant, we often use sodium hyaluronate during surgery, and it's often that we coat the ocular surface with the residual sodium hyaluronate that is left behind at the end of surgery. And we know that probably it helps protect the corneal surface. And similarly, using sodium hyaluronate drops post surgery might help to stabilize the corneal epithelium and the corneal healing probably faster than if we use probably other medications. Of course, it is a situation where we know the donor epithelium is going to slough off. We are using a large number of medications and often preservatives on the ocular surface post keratoplasty. The graft surface itself is neurotrophic. and there are often tear film resurfacing issues because the curvature may not be as uniform. So with all these issues, we see clinically that in the first 2 or 3 weeks following a corneal transplant, the graft is clear, but the epithelium is not very healthy, and therefore the patient often is not seeing as well as we would like to, even in the first few weeks. So probably again using a drug which might aid the epithelial healing maybe a good option. And there are some studies again in literature which have looked at epithelial healing following a corneal transplant. So basically what I was thinking was that there are several indications in our clinical practice other than the routine dry eye cases where sodium hyaluronate may have an advantage because of its various properties. And I think it's time that probably we look into some of these cases and see whether the drug can help our patients heal better and feel better. Thank you.